As it stands, patient rights to access guarantees that patients can access records for an equitable price and in a timely manner from their providers. Patients have a legally enforceable interest in the information contained in their medical records and have a right to access, review, and obtain copies of such records. The only exception to this rule is if the information could be reasonably expected to cause identifiable and significant harm to the patient, such as patients in a psychiatric hospital, drug treatment program, etc. According to the U.S. Department of Health and Human Services rights under HIPAA patient access, a covered entity must provide access to the PHI requested in whole or in part no later than 30 days from receiving the individual's request. With 30 days noted as an extreme, providers are encouraged to respond as soon as possible. When utilizing health information technology, the expectation is that this information would be provided even sooner. If a provider is unable to do so, they may extend the time by no more than an additional 30 days, notifying the individual in writing of the reasons for the delay and provide the date in which the access will be provided. The HIPAA Right of Access Initiative, announced in 2019, allowed the Office of Civil Rights to highlight the right of a patient or patient's personnel representative, such as a parent or guardian, to receive their medical records. Access is a fundamental patient right under HIPAA, and the OCR has expressed concern that covered entities, which include healthcare providers and health plans, were failing to provide timely access, not providing access, or overcharging. The Office of Civil Rights issued a notice of proposed rulemaking outlining upcoming changes related to patient access, which in part include the following: shortening the time for responding to a request from an individual to access their healthcare data from 30 to 15 days, allowing patients to inspect their PHI in person and take photographs of their medical records and or notes, and also ensuring that individuals are not faced with unreasonable measures when exercising their right of access. Today, there are 6 types of HIPAA right of access violations, which include not providing access in a timely manner, failing to provide access to personnel representatives, denying access to the patient, failing to send records to a third party, not providing access in the requested format, and charging excessive fees for producing copies of patient records. Aside from the costs associated with non-compliance related HIPAA right of access provisions, which can be monumental, there can also be disciplinary action from the New York State Department of Health. Lack of access to patient medical records delays patient safety and greatly impacts the continuity of care. As we move forward to the next portion of the presentation, we will provide additional information on some relevant cases and impact.